that the unit that we're starting today for the level 3 is the health promotion unit. Okay, and I'm just going to give you an idea of some of the objectives of the health promotion unit. So the learning outcomes we're looking at is over the next few weeks is we're going to understand about public health policy and how it's developed to improve the health of the population. Okay. I'm going to focus very much on how it developed in the UK and probably Europe. And then I'm going to get people to sort of bring in information from their own countries as well. So when it comes up, we'll do part of research in that way as well. So we're going to talk about how, as I said, policy and how it's developed. We're going to talk about what are the sort of factors that can affect health in the population. So we're going to look at some data and maybe some statistics, or you're going to go off and find things for me as well. They're really going to talk about how health promotion can encourage people to adopt a healthy lifestyle. And we're going to look at some of the different models of health promotion and how they encourage people to change their lifestyle. Okay. And then finally, and quite importantly, you are going to develop a health promotion campaign, a small campaign that you're going to do to friends, family, or people that you work with. That's up to you. And then you're going to carry out your activity, and then you're going to come back and tell me how it all went by doing a presentation. Okay, so different to your level 2 where you just sat down and wrote assignments, some of the level 3s, at least a couple of them, have presentations to do. And this one particularly has a little campaign where you've got to get active really, and you've got to go out and about talking to people and get some ideas. Okay, so before we go on, we're going to think about, you know, let's think about health promotion. And first of all, let's think about, what does health mean to us? So you've got 5 sentences here. I feel healthy when. I am healthy because. To stay healthy, I need. I become unhealthy when. Or my health improves when. And I want to go around everybody. You can choose any one of these sentences to use, and then you put your own bit on the end of it. Okay. So I'll give you a clue. I'm going to choose the middle one, and I'm going to say, for me to stay healthy, I need to do lots more regular exercise. Okay, that's the one for me. So I'm going to ask you to go around and choose any one of those and just give me a nice sentence about yourself. We know just by doing that little exercise that health can mean different things to different people, or different things make people feel healthier. So for one person it's one thing, another person it's another. We are all different and our bodies work differently. So we tend to know what's good for our body or what makes our body work better. So it's very important that when we're looking at promoting health, we are treating people like individuals and realizing that different things work for different people, okay? And not to just assume that everything goes in the same way. So the negative, health has 2 different definitions. It can have a negative and a positive, okay? The negative definition of health is the absence of disease or illness. And it's probably the way we looked at health like many years ago. You know, as long as I wasn't sick, I'm healthy. But nowadays, it's got a much more positive definition, as you can see, which covers a much sort of wider area. So it's not just about not being sick. It's something a bit like what Austin said. It's about, you know, putting everything together, your physical, mental, and social well-being. And well-being, you know, feeling good and comfortable and positive. So that's the sort of more modern definition of health. And it's the one that we look to really when we're talking about promoting health. So we're looking now at health education versus health promotion. Health education came first, really. It was around for a long time. And then health promotion sort of superseded it, really. Okay. And I've done a little chart here where you can sort of see the two things together. So health education, when it was developed, it was particularly concerned with educating and informing people. It wasn't desperately there to help you change. It was about giving you the information that you needed. But nowadays, health education is really only one part of what we do in regard to health promotion. Okay, so the education aspect of it is just doing one part. So nowadays, health promotion has gone, as I said, gone this step further to improve someone's health via education and thinking about the psychological, cultural, social, and political factors. And to do that, they have to change society in places. So if you look at my health promotion versus health education chart, you'll see that health promotion takes another form. It's about policy development. It's about influencing the government. It's about gathering statistics so that appropriate decisions can be made at government. And it's about having an emphasis, having a look about social and political factors that are not working to help people be healthy. And it's about, as I said, influencing government policy and changing government policy as well. So we would be looking at areas where there is poverty. We'll be looking at areas where people living very poor housing, because all these things have an impact on people's general health. So the role of a health promoter is to be working in all aspects. And some people specialize in different areas, but it's, you know, the education part of it is just a small part of the story, really. Then let me give you a little bit of a history. Okay, in Northern Europe, there were massive changes because of the Industrial Revolution. That happened in about the late 18th century. A lot of people moved from the rural areas where there wasn't enough work and people were fairly poor. They moved to the cities and the big towns where the factories were developing. Now, although I'm talking about Europe particularly and the UK particularly, these sort of revolution, this movement happened in many countries as well. Now, some of the countries that you live in presently probably have still quite a lot of rural work, but I know that when you go, say, when you're in Malaysia and you go into Kuala Lumpur, there is a massive difference between when you're in the country. And you can see in the cities where all the business takes place and where all the industry is and the manufacturing and that. So it isn't really that different. It might have happened at a different time in history, but maybe you can think back to your own countries about see what things have changed. Okay, but in Europe, it was in the 18th century. People moved into the cities to work in factories. The big population changes. And what happens was these cities and towns became very overcrowded. And the living conditions for poor people was really bad. And there wasn't a lot going on about, you know, managing cleanliness. So things like cholera and typhoid were a problem, waterborne diseases, because, you know, we didn't have clean running water and taps and things like that. So the water was quite contaminated. And the government realized, even in those days, that they probably would have to do something to improve the health of the public. So one of the first people who sort of got involved in public health was Edwin Chadwick, 1842, who led a commission looking at what they could do to improve it. And the main areas they focused on was housing, sanitation, and unclean water. And that's because of that, the first Public Health Act came along. I'm not saying things were perfect, but they certainly started to make an effort in the right direction. And this rolled along for a while because this was under the Victorian society, and the Victorians had a sort of very benevolent view of what is expected of the wealthy to, you know, give some care to the poorer people around. And that was starting. Quite a lot of good things were developing. But at the end of the 19th century, the rise of the trained medic actually sort of took over a bit and sort of pushed out some of the work that the maybe untrained people were doing on the environment and the social conditions, even though it was extremely valuable. And we got sort of very tied up in what is known as the medical model, which is very much focused on ill health and disease and curing disease. There was great leaps and bounds made in, you know, the development treatment of well-known diseases in those days. And so the medical model took over, also took over because they were very well trained and people had a great deal of respect for that level of education. So they didn't get questioned that much. So they became much more important people in that respect. And I think, you know, I mean, I don't know if it's quite as much today as it is here. Many years ago, you know, the local doctor was a highly respected individual, and I'm not sure if it's quite so now. There are other jobs that are respected as much, but if you lived in a village, the doctor was, you know, quite an important individual because he made you better. You know, he had this skill that nobody else had. Now, some of you may have experience about that from in your backgrounds. If you lived in smaller towns and villages, that maybe still be so. A lot of political change in the 60s and 70s started questioning, you know, the medical model, which was all about, you know, developing new drugs and new treatments, was fine, but it was becoming excessively expensive. As drugs became more complex medicines, they also became more and more expensive, especially trying to treat heart disease, cancers, things like that, which they still haven't found a cure for. So they've been researching it for many years now. And although there have been some great developments, you know, we know that there are some illnesses that we can't cure yet. And they started to look at, you know, the value of just taking a purely medical approach to improving people's health. And they've also started to think of maybe there are other things that we can do as we go along. And they're reflecting really back to the old work that we did during the Industrial Revolution, when the Victorians were sort of in charge, which was really looking at improving people's standards of living, improving people's diet, clean sanitation, clean housing, those sorts of things, which, you know, if people had that, they could often avoid some of these diseases. Not every disease, not things like cancer and that, we appreciate that. Although we did go on to research that some cancers were actually created by some of the environments that people worked in. So research started off in that direction. But things like TB, pneumonia, waterborne diseases, these things that we could deal with. Simple hygiene, those of us who have done courses before here We know that things like hand washing is really important, just to keep hygiene so you don't pass diseases from one to the other. So these sorts of things were being looked at. What else could we do for the population rather than just giving medicine all the time? You know, could we actually try and stop people getting sick in the first place? So this is a different view. And also this is where some of the health promotion education came from. If we tell people about diseases, if we teach them how to manage things, if we teach them hygiene, maybe they can stop giving it to each other, you know. So, and that's a way of actually saving money on medication, which, as I said, was becoming a very expensive process. Then the new public health movement really got going around the 70s, 1970s, middle of the 70s. And as I said, it was a report that just says a bigger emphasis on the environment and people's behavior rather than just researching the disease. And they looked at the 4 different health fields, really. Medicine and healthcare services, obviously that research needed to carry on in that, developing new medicines, but also looking at people's lifestyles, doing research into people's lifestyles and behavior to see what you could change. Looking at the environment, as I mentioned before, housing, pollution, cars, of course, were developing then, and there's changes they were bringing with them. And human biology in general, what was changing, what was evolving. The World Health Organizations actually had a conference to actually set goals for the whole world. And they developed the global strategy for health. Now, the first one was around 1977, but over time, more and more countries joined in, and more and more countries got involved in setting the goals for the world. So all of the countries that you and I live in or have lived in are now really considered by the World Health Organization. And with some areas, they look at particular challenges, but they also set targets across the world as well. Okay. And again, they're very aware that it's not just about curing illness, it's about looking at, you know, do people have enough food to eat? Is the water clean? Is the sanitation functioning? Is their housing safe and not damp and, you know, livable? And do people have jobs? So then do they have incomes? If they have incomes, they can buy food. Okay. One little bit of homework I'd like to give you to do is to just read up on the development or the history of the World Health Organization. You can easily Google that, just have a little look at it, okay? Just so that you're aware, because when we're looking at health promotion, the World Health Organization comes up quite a lot. In fact, it comes up in some of our other units as well. So it'd be nice for you to know a little bit about it. So please make a note of that for a piece of homework. Okay, the International Conference in 1986 was the Ottawa Charter, and this gave them a lot of focus for health promotion. And it said the action should be directed in building healthy public policy. So it's the first one that's saying like countries need to have policies about how they support the people that live there. Creating supportive environment, so making sure that an environment was safe and sound for people to live and work in. And that's also about, you know, looking at factories to see that they weren't dangerous for people's health, which some of them were. Strengthening community action, giving some of the people some power to take a bit of action and to do things and to change things. Developing your own personal skills, so finding ways to educate people and to give them the skills to look after their own health. Now, some of you were talking about some of the things that you do to maintain your health, like hydrate, like eat well. And you've already got those skills. Now, this many years ago, people hadn't quite developed the skills. They were always looking around for advice. It wasn't as natural as it is today for people to know all about, you know, how to eat a balanced diet and that. And that's the level of education that's changed over the years. So one of this, the Health Promotion Conference was focusing on developing personal skills. So people get to where you are now when you learn from the TV, from your families, all sorts of different ways, from things that you read, from magazine articles, how to do, what's the right way to eat, and, you know, how to take enough fluid, all those sorts of things. And the other thing was reorientating health services. And this is when they started looking at health services, not just purely jumping in and curing something, but also about trying to prevent things happening in the first place. So you hear a little bit more in the 80s about preventative medicine. Okay. And here's their little logo of the Health for All and All for Health, the World Health Organization conferences. And these happen, they've carried on happening most years, really. And if you have a look around the dial, you can have a look at the variety of different areas, and you can see how wide the health promotion role really is. Okay. They see the different ways they're looking at things. So even down to number 14, supporting the restoration of fish stocks, because fish stocks across the world went down because of the way they were being fished, and they had to actually do some work to try to get people to fish in a more sustainable way. And you probably know more about that in Malaysia than I do, because a lot more fishing goes on there in that respect. But in Europe, people were blowing fish out of the water with dynamite, and as you can imagine, that caused lots of problems. So there was lots of sort of stuff there. If you have a look at number 5, talking about gender inequality, it's another aspect because it affects people's health. Talking about violence against women and domestic violence, these things were never really considered before, but of course they have a dramatic effect on people's physical and mental health as well. Okay, so lots of things for you to look at there. Make yourself familiar with that dial so you get an idea of what the global conferences on health promotion really considered. Okay, so I'll tell you a little bit now about the sort of health promotion job. Some of you might be interested in it. Some of you might be interested in some aspects of it. Some of you might not at all. But health promotion, they have a few different levels of worker, and there is a very clear career framework and a specific training if you wanted to do that. They have some entry-level jobs, like someone who's maybe active in the community, someone who's a healthcare assistant, so that would be like someone with a level 3, or a teaching assistant, and they might want to go on to sort of get involved in some of these other courses, really. And each one of them has very specific training. So you might move on to becoming a senior healthcare assistant at level 3, an assistant to a health visitor. Health visitor usually has a degree and a nursing training. But as an assistant, you often need like levels 3s and level 4s, and that will get you there. Level 4 will get you assistant practitioner roles, or again, if you're a health visitor or a qualified social worker. So as you can see, there are steps to move through, and most of these jobs are based in the community. Some of them are based in hospitals or from hospitals going out into the community. The next levels, you've got the active practitioners. You probably know about some of these. They will be children's family nurses. They will run clinics, a practice nurse, a mental health nurse, an environmental health officer. They all work about the same level, and a health improvement manager. So that's someone who works more on the political office-based side of it, maybe not working directly with the service users. And then people can go on to be senior practitioners. They usually take specialist courses for that and get quite a lot of experience. And then advanced practitioners. And again, they have special accreditation. You can be a consultant practitioner, which would mean you'd put in lots of years, you'd have degrees, masters, possibly PhDs. And then on the management side as well, you could become a team manager or go on to be director of public health. So you might take the more political side of the role, or you might take the more specialist practitioner side of the role. And there's lots of ways to go. With the advanced practitioners, they tend to be quite specialized. They'll do like, you know, nutrition. That will be one of their specialist areas. Somebody will be a smoking advisor, or a particular area of public health, like environment or climate or pollution or something like that. And they will be they may work on very special campaigns. So that's all I have to introduce health promotion before we get going. Has anybody got any questions on that? Anybody want to know any more about anything?
So far, so good for me.
So far, so good. Okay. 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 And what I'm going to do now is I'm going to introduce the assignment. I don't normally introduce the assignment in the first session, but because this one has got a campaign involved in it, we need to spend a bit of time thinking about it and talking about it. Okay. Okay, so the assignment is broken up into tasks. So in that sense, for those of you who did the level 2, it's not that different. You have specific tasks which will be related to specific sections that I will run with you. Okay, and then you should be able to find most of the information for your task from our work, our session work, and maybe any extra reading that I might give you. Okay, so what is different here, which is something that you didn't do in the level 2, was it has a limited word count. So you're going to have to develop the skill of working within the word count that's given you. Okay, and you're only allowed to go 10% over or under. So once you've sort of written your answer to that, you really have to go through it and just, you know, count that you've got enough words, or not too many words. More often, most people tend to go over rather than under. So that's one of the skills that you have got to develop that's a little bit different. So I'm expecting you to do that. And I do check. This time it's different because I mark your assignments as well. Okay. And I'll mark the assignment sort of fairly quickly after you all hand in. You know, there's a deadline to hand in. I usually mark them within maximum 2 weeks, so you'll get it back by then. Okay. So task 1 is thinking about public health policy. You're going to have to talk about how public health policy is developed, a little bit about the history, the sort of groups who can influence it, and then you're going to talk about how the government monitors that. We're going to do that. Quite a lot of that we'll do in our session on Thursday. Okay. The next task you see is slightly smaller. It's 200 words of writing. And it's about the factors that affect health. Okay. We're going to talk about that. I think that might be next week. Oh, no, 2 weeks time. Okay, we'll be getting to that. And we're going to talk about all the different types of factors that affect health and the potential benefits of improving health. So before I move on, what sort of ideas I know we haven't done the work yet, and I know you haven't done the research, but can anybody think of the sorts of things in the country that can affect people's health? Yeah, I mean, just phone use and that alone has created sort of unusual health issues that certainly didn't exist before, hasn't it? And there are some that say it might have something to do with ADHD, attention deficit disorders, because of all the screen flicking and things like that. And they also believe that it's affected children's concentration, because the way they use mobile phones now, you move from one thing to another, you don't actually concentrate on it for very long at all. I think we all know that experience just from looking at Facebook streams, Instagram, etc. And there is a belief that might have affected the way children can actually concentrate in their lessons at school, that they're not able to sit down, on one subject for a very long time because they're not used to it because of phone use. So technologies are quite a good example, actually. Okay. The environment, cleanliness, yeah. So general hygiene, really, street hygiene and home hygiene can affect health. So that's about understanding knowledge, having the skills to keep the place clean, know what to do when a problem arises, know where to go for help as well. That's quite important. Yeah, job overload, work stress. Yeah. I mean, that's becoming more and more as people are trying to get people to do more for their money and, more aspects of their job, or take on less people but get them to do more things. And that's causing both physical and emotional stress. Yeah, so physical stress, actual tiredness, or, being worn out, really, or emotional stress. Yes. And medical care. Okay, what the quality of medical care, Elsa? Yes. So depending on where you are, what quality of medical care you're getting, or whether, if you live in a country that's an insurance-based system, which quite a few countries are nowadays, if you can't afford to pay your insurances, or you can only afford, a small insurance, then you might not be able to have the operation or the more complex treatments that maybe your illness requires. Is that sort of what you meant? Yeah. Okay. So it's about being able to access medical care. So that's also so it's not just a medical issue, is it? It's about, your financial abilities. If you're working and you've got a good job, you can access this thing. If you're not, it becomes a lot more difficult. So we'll be thinking about ideas like that as well. Okay. We're going to have a little think. So what are the benefits of improving? If we can do all these things, what would be the benefits of improving health, do you think? Why is it important? To live long. Yes. Yeah, I mean, our life expectancy is going up as health development happens in the country. Life expectancy is going up. Could there be a problem if we all live for a long time? We'd have to make sure the country could afford to keep us, really, wouldn't we? Because after a certain age, your earning potential goes down quite a bit. And you need to have enough money to keep yourself in your old age as well. So although it sounds really good, and it is true that when we do health promotion, we look at the statistics about mortality. That's, you know, when people die, and the countries that have low mortality or longer life expectancy are considered to be, you know, the most productive, the ones who are functioning the best. But there is the added complication of, you know, where do you put everybody eventually if people don't die that quickly, you know? So that's something that we have to think about when we're writing our assignments as well. We need to, if you've had a bit of practice about balancing strengths and weaknesses, so you will be writing about discussions and debates where you'll be having to look at two sides of a problem. Okay, so just bear that in mind. Okay, let's move on to task 3. And task 3, we're going to be quite practical. We're going to talk about the different models of health promotion and some of the approaches that they use. You'll be learning about that next week. Okay, we'll be looking at the different approaches and the sort of activities that you can do in those approaches to promote health. And this one's really important for you. You're going to have to do a 200-word write-up here where you're asked to evaluate 2 models. Now, evaluate, as I said, that's when you talk about your strengths and weaknesses. So you balance the discussion. Okay. So you're going to be able to choose. We do a few models and you get to choose which 2 you want to use. And where you have to evaluate, as I said, you do a bit of a comparison too. And then you talk about the approaches. And hopefully this is going to give you some ideas in how you do your campaign. Okay, because the campaign is really important. And one of the things you have to decide by next week is what sort of campaign you are going to do. So we'll have a little think about that now. So this is task 4. Okay. There's 2 quite important pieces of work. Okay. The first one is you have to create some health promotion material. And you either have to create a leaflet or a poster or do a video. Okay. You can choose what you do. Once you've decided your campaign, all the aspects of your campaign go together. Okay, so everything you do in task 4 relates to the one campaign. So the sort of things you could do is you could do a campaign about smoking. You could do a campaign about heart disease. You can do a campaign about obesity. Somebody actually did do a campaign about young people and mobile phones, actually, and she did it with she taught a group of young students, so she did a video about, you know, how to use your phone better. So she did a special video that was aimed at the children, which was quite good fun. Some people created leaflets. Quite a few people just did a poster. And the poster was really, could be something that was just eye-catching, just reminding you about something. Or some people included a poster as part of their campaign, so that if they were going to do like an educational campaign where they were going to have people come and listen to them while they told them about the subject, the poster would be related to it. So there's quite a lot of things you can do, really. So as I said, 4.1, you've actually got to do a poster, a leaflet, or a video, which is part of your campaign. And then you've got to deliver that campaign. So you've got to have a plan and show me a plan. And it's all got to be done by the end of the unit so that you can feed it back. And then the last piece of work you do is you review your campaign, okay? So you hand in a little piece, you've got up to 300 words to analyze any effect. So you might have some data that said, you know, 10 people out of 12 said they were going to give up smoking. You might have some data that said, you know, 10 people decide to join an exercise class. Also, you need to have said, you know, where things went well in the campaign, where they, you know, weren't as good as you would like and you might want to change it, really. So it's, you know, what was the effect of the campaign? Did it get over the message that you want? Or, you know, would you do it a bit differently another time? It doesn't really matter. You know, it doesn't have to be a perfect campaign, because the idea is that you just learn from it. So no one's expecting you to do a fully professional one, and you've got to keep it within a sort of sensible way of looking at it. And what we'll do is, once you've decided on what your topic is, I will just check in with you at the end of most classes to ask how you're getting on, and to, you know, you can give you time to ask any questions. But you know how it works. You'll all be on a WhatsApp group, so you can always ask me questions as you go along anyway, as part of the development. But the biggest bit that you need to think about at the moment is to identify who are you going to work with, and what are you going to do? And that's really the most important thing at the moment. Okay. And then sort of think about what sort of planning you're going to need. So don't overdo it. Don't bite off more than you can chew. Do a small group. The previous tasks, task 1, 2, and 3, you're going to write up like you've done before, like a sort of essay style. And then when it gets to task 4, you'll put the heading of task 4, and you will say, you'll just say something like presentation carried out on the 21st or something like that, so that when you hand in that document, I will put some places up on Google Classroom for you to put your posters or your promotional material and your videos, okay? Just so that I have them. If there's a problem, I'll just keep them myself. The videos will be done as part of your presentation, okay? Or if you've got a leaflet or a poster, you will show that as part of your presentation. So when you do your presentation, you'll do a slideshow. Anyone who's got a video can show their video first, and then they will do their slideshow. The slideshow will tell me about your process, about what you actually did as part of the planning, okay? How it went, and that sort of thing. So no, you won't be writing it all up, but I will collect in the posters and the leaflets or the videos need to be electronic so that I can put them up on Google Classroom, and they need to all come in by the you need to have finished everything by the whatever the final assignment date is. No word count for your poster or your leaflet. The only 300 is 4.3 when you just do a little write-up when you talk about any effects or problems or data gathered from your campaign. You just do a written paragraph there, and you'll put that with all your other written bits of the assignment. So that will be task 4.3, and that's only 300 words. Your leaflet, poster, or anything you create for your campaign has got no word limit. You won't, I mean, posters, they don't have a lot of words on them anyway. And your leaflet, the most important thing about it will be to be eye-catching and informative. And again, you don't put lots and lots of words on those, but you're not restricted. Okay, so it's just 4.3 has a word count, where you just write me a paragraph telling me about how the campaign went. Did it go well? What sort of bits of research? I'll be talking to you a little bit more about that, but the main thing really is that you identify, did anybody, were anybody planning to change their lifestyle for your campaign or change their eating habits or whatever you're doing. Like I said, the sort of things that people chose last year, I'm just trying to think. Someone did smoking, somebody did heart disease, and all what went with it really, diet, education, health, exercise, that sort of thing. We had someone did oh dear, I'm just trying to think, because it was COVID time, somebody did something about PCR testing, which was actually quite good, about how to get a test, when to get a test, and what to do. And they, went through, they did a little video. They did a demonstration as part of their teaching of, how to take a PCR test and things like that, and where it gets sent to. So you can do something fairly practical like that. You can do something on drinking. You can do something on diabetes. I think somebody did managing diabetes and insulin and things like that. Oh, I don't know. Just trying to think. As I said, somebody did something about young people and mobile phones. Somebody did another one about young people as well. It's about nutrition with young, aimed at very young people, just learning, their sort of first learning about, balanced diet and that. So they did, and it was quite nice. It was quite fun and lively with like a really jolly poster. And they actually taught children about, fruit and vegetables and things like that. And again, they were lucky because they also had access to a school class. So they just did it in a classroom environment. They just told the school, and the school was happy for them to do it. So they put a bit of time aside in a classroom, and yeah, did a thing about good nutrition really, and made a jolly poster, as I said. So that was quite an effective one as well. So if any of you work with young people, you might want to think about doing something that's very much focused on them. It doesn't have to be too complicated, but it's more about, getting them to have a go at things really. Had other people who one other group actually just did an exercise class for older people, and she talked about the sort of the effects of staying supple and fit when you're a lot older. So I think she had access to, you know, an elder group through her own grandmother, I think it was. There was an elder group that went, and she just went and did a little session for them. And you know, you can either film that, or if not, you can just explain what you did. And she just told us about the little exercise routine she did with them and how they felt afterwards. And then she interviewed them and asked them how they felt. Did they feel, you know, were their muscles moving? Did they feel less stiff and that sort of thing? So that's quite good. Well, one of them did a sort of weight watching advice idea for mums who not long had babies. And, you know, just talking about, you know, once you'd had your baby, about trying to a bit of sort of what to do about, you know, dealing with your baby weight and things like that. So it's because again, she had small children and had a group of people who were not that far away who also had small children. So she got them all together in a room and they had like a discussion group. And so there's lots of approaches you can do. You can do, as I said, we will talk to you more about some of the methods you can use a bit later on. I think that's next week when I talk to you about the approaches, and that will give you an idea of some of the activities you could possibly create. But it's sort of up to you, really. It really depends on your target, whether you want to do a straight educational one, or you actually want to do surveys with people and then give them different ideas and then survey them again, you know, or you want to do a physical activity, really. As I said, quite a few people just had a discussion group, people talking about, you know, what they gave them some information, then talked about some of the difficulties, and you know, together as a group they tried to find a way to resolve it, really. Some people did it because, you know, they go to other groups, other society groups and that, and they just use those. I'm just trying to think. So if you're not sure, really it's just about finding something that you find interesting as well, because if you're interested in it, you'll make a bit of an effort and you'll do something better. But don't worry about it. Remember, you're all in the same boat. You've all got to do it. That's the thing about the level 3. We have more presentations, we have a lot more speaking up, and a lot more group work. We haven't got any today, but normally we usually do have group work. And, you know, I expect people to really participate in that. We can't have people disappearing on us, because it doesn't really work in the level 3. It's all about the information and the information that you share with your colleague, because you learn from each other, really, and you bring your experiences, which is the important thing. Now, some people who did it before actually work in different settings and are able to use the settings that they work in. So, you know, does anybody here teach? I know Austin teaches. Is there anybody else who teaches in the group?
No, teacher.
No, okay. Because when you teach, you often have some willing subjects there that you can usually find time to do this campaign with your groups. Now, Foyaz, I know you work in a clinic, don't you? With different sorts of people. Is it a general clinic? Are you with us still, Foyaz? Oh, I think he's gone somewhere. Okay, anybody else? I think somebody else works in a clinic, don't they? Is there somebody else? Because we might be able to sort of use the activities that happen in the clinic. You might be able to do something if you talk to the people who work there, just say, I've got this to do. But I know Foyaz works in a health clinic, so I'm sure we had some people last year who worked in a health clinic, and they were able to do something with some of the clinic people, you know, just focused around, I think, I can't remember what it was diet and nutrition, I think. Does anybody else work anywhere else where they think they might be able to get people involved? Anybody else? Anybody work in a shop or anything like that where you can maybe do a questionnaire asking people when they come? No?
Not really.
Not really. Okay. Because we did have some people who worked in things and were able to do it. Okay, well, we'll work on something. We'll come up with something for all of you. So what I'd really like you to do, as I said, is to think very much about what you might do, okay? And don't leave it to the last minute, as Willy Wonka here is saying to you, okay? So start getting some ideas now. I will be around to help you with the plan, and we'll be looking at that plan a bit later on. Class 4, we'll be talking about the different types of activities that you could do. And class 5, we'll spend a lot of time talking about planning. So you could bring any of your worries and concerns to session 5, where we're looking at planning that campaign. But I would expected you by session 5 to have at least got some ideas together and you know, maybe put some questionnaires together if that's what you're using. And you should be coming to me then with some of the complications and any of the problems that might arise, okay? But I will be going over it then. And that will give you 2 weeks to complete it, okay? So like I said, it can't be a big thing, and it's usually just a one-off thing, a one-off session, or you know, just sitting down with people and having a discussion group. So have a think about it. So start now and start thinking as you go away. I want you to sort of think, what can I do? What topic can I do? And who would I do it with? Okay, because I want you to come back to me on Thursday with an idea of what you'd like to do. And I'll tell you if it's too difficult or too practical, if you've got to make it smaller or bigger. I'll give you the advice for that. I just want you to come on Thursday with your initial ideas, okay? And then your initial ideas about who you're actually going to do this with. So you might want to sort of chat to your family and think if they've got any ideas as well. As I said, some people use like mothers groups. Some people used young people if they had access to them. Some people used a load of elderly people. They went into a care home, or they did it through grandparents where they had some sort of social group which they went to. A guy before who did the PCR testing, he works with the community from Myanmar, and he did it at a community centre that they had. So he just got a few people who were just attending there at the community centre to come in and sit in on his session. So you need to be creative. You need to think about it. Okay. So any other questions now? No. Okay. I've given you a lot to think about. So we're going to finish a little bit early today. Okay. Sometimes people actually went away, and after a while they did change their minds. That was okay. I wouldn't leave it to session 5 to change your mind, but I think in the next couple of sessions you can change your mind. So come to me with ideas. I might advise you that that might be a bit too difficult or a bit too much to take on. You might want to rethink it. So let's see what happens. Okay. That's it for today. Okay, so we're going to finish a little bit early today, so you can go and have a good think. All right. Bye.